Good evening, everyone, and welcome to our Feline Friendly Month finale with the lovely Alex Taylor, also known to probably some of you as the Cat Nurse RVN on social media. Very lucky to have Alex joining us this evening and ending our month, so I hope you all enjoy it. This evening we'll be talking about tips for improving quality of life for creaky cats, or are they just getting old? So get your questions ready, and Alex is very ready to answer them all. I hope you've enjoyed this month, and I hope this finishes off it nicely for you all. Before I hand over to Alex, I'm just going to show you this video. This is one of our CAM resources, which is free to owners and also professionals. It's called Is My Dog in Pain? And it helps to point out signs that you may not think of necessarily as your dog showing pain. So it's a great resource for veterinary professionals or pet professionals that think, I really want this owner to understand more what I'm talking about. You can send them over to here. You can find it on our website and also in our member zone. So head over and have a look. Cool. So over to you, Alex, if you'd like to introduce yourself.
Thank you very much, Evie. Yeah, it's nice to be here. I feel very honoured to have been asked to do this and also to be the grand finale for your feline month.
It's some fireworks.
Yeah, I think we should have some fireworks. Not noisy ones though.
No.
Yes, hello everybody. My name is Alex Taylor. I am a registered veterinary nurse and I have been qualified for, dare I say it, 26 years this year. So I've been working mostly in first opinion clinical practice during that time. And I do still do some shifts in clinical practice, but recently in May last year, I was lucky enough to get a position with a fantastic charity called International Cat Care. And I now work for them 3 days a week as their cat wellbeing and behaviour advisor. So that's the sort of bulk of what I do. But as you said earlier, Evie, I also run my own social media pages, the Cat Nurse. I'm on Instagram as well as Facebook. And the whole point in me setting those up was really just to provide some advice and tips to all cat caregivers about feline health and behaviour. And actually, I looked the other day and my Facebook page has been going for 8 years, which I just cannot believe it's been going for that long.
It goes so quick, doesn't it?
It does go so quick. So that's something that I've been doing that for a while. I also provide in-house CPD for veterinary professionals and do some external lectures as well. I'm also currently studying to get my Animal Behaviour Technician award because behaviour is pretty much my bag. That's what I'm interested in, or any links between sort of health and behaviour. And I want to highlight that this evening.
Yeah, definitely.
Kind of intrinsically linked. And then on top of that, I'm also the Senior Vice President at the British Veterinary Nursing Association.
Not a lot then.
No, not much. Quite a busy bit. A large portion of what I do is very much cat focused.
Amazing. Yeah. So I think a good point, as we are on the veterinary nurse point, I think a good point to start with this evening is how your veterinary nurse can help you if you feel that your cat is in pain, or your cat might have osteoarthritis, or you want some more information. Nurses are there to help, and like you said earlier, that they're probably the first ones to pick up the pain, aren't they?
Absolutely. And I think it's important to understand, obviously we have the vet to make the diagnosis of osteoarthritis, or there might be other issues going on as well, because sometimes with older cats they can get these sort of concurrent diseases and illnesses. But the veterinary nurse is there to help support the owner and to help manage that cat's health or behavioural issue, whatever that may be. And yes, you're quite right. Often the veterinary nurse is the first person in the team to notice that there's starting to become, there's a bit of an issue there. And I've found in my experience, it tends to be two sort of classic examples of that would be a cat that comes in to see me, an elderly cat usually, because its claws have overgrown. And the reason that's happened is because it can't stretch up to scratch properly, usually because there's some discomfort there from some sort of joint problem, like osteoarthritis or degenerative joint disease. I can never say that. Or sometimes as well, we get cats that get mats, they get matted fur because they can't groom properly because they've got some arthritis, or there's perhaps some problems with the discs in their spine as well. Or some, something we call spondylosis as well. They get these little bony deposits on the spine. So they're the ones that we sort of classically see. And usually I'll start to talk to the owner, say, why are you here? What's going on? Why do you think this is occurring? And then they'll start to talk about the cat's behaviour, which it's so subtle with cats, and it's so gradual, and they hide it so well because they are masters in disguise when it comes to pain, that I can absolutely see why an owner or caregiver might not notice there's a problem there until it becomes quite obvious. And I think for veterinary nurses, that's a really crucial moment for us, because we can then have that conversation about how that cat's behaviour's changed. And try and help owners understand that there is a link between that behavioural change and that cat experiencing some sort of discomfort.
And I think as an owner, if you have an old cat at home and you think, oh, yeah, my cat is a little bit matted actually, or my cat's claws can be a little, they do have to come in and be clipped, and you haven't spoken about arthritis or pain in your cat. There's a lot of resources, isn't there, that you can do of that show you like signs of a cat in pain, that you can tip and be like, oh yeah, that one, that applies. Might be not jumping up as much, which
sorry.
No, you carry on.
I was just going to say there's checklists that you can do. You can either do them at home and take them into the practice and give them to the vet or the nurse. Or you can do them in the clinic with whichever veterinary professional you see. And then that will help the vet to decide, okay, have we got some pain here from osteoarthritis? I mean, I would always recommend cat caregivers to look at the International Cat Care website for anything to do with feline health or behaviour generally anyway. But there's also another website sort of that's been put together by International Cat Care called Cat Care for Life. And it's got some really good resources on there and information on there for cat caregivers, but also for veterinary professionals as well.
Amazing. Perfect.
And in there are some checklists. Now, the checklists are under the vet and nurse section, but anyone can access them. And there's a really good mobility checklist on there. It's really easy to use. And it just helps caregivers sort of make that connection between, because sometimes when you ask people, have there been any changes in your cat's behaviour, or do you think your cat's uncomfortable or in pain, they'll often say no. But when they go through the checklist and they'll go, actually there have been some changes.
And I think also because most cats, I mean, I've got one cat that's literally all on top of me all the time, and I know what he's doing every second. But then I've got another cat who's quite aloof and will come in the house and just skitters around, and then she's kind of gone again. And so if I was to take her into the practice and they'd say, is she in pain? I'd be like, I don't know what she does half the time. It's hard to tell.
It's very hard to tell. And I think that's a really good point. It very much depends on that cat's temperament and how socialised they are with people. If you've got a cat that doesn't like spending that much time with people, and there's plenty of cats out there like that, and that's absolutely fine because that's just them. That's what they do. I can appreciate it would be much more difficult for caregivers to notice that there's sort of any sort of issue going on there. And because they are they're programmed as these little survivalists. They think they're little wildcats still in the domestic cat minds, and I use the word domestic loosely because I don't really think that they're domesticated. They're very good, and they are prey animals as well as predators, which a lot of people don't realise. They're really, really good at masking pain. They're also very good at adapting to to how they need to in order to kind of survive, if you like. So it's difficult. I think it's difficult for people to see if there's a problem.
Definitely.
That's where nurses come in. Where veterinary nurses come in, and the veterinary team, we can help people see those changes,
see the different changes. And behaviour changes. What would be a common thing that you see in practice that people come to you for?
Yeah, so there's a lot of different behaviour changes with cats with osteoarthritis, and I think, as I said, they can be subtle and they can happen over time. And something that a lot of people, both veterinary professionals, I think, and caregivers don't realise, that with cats you don't get that obvious lameness that you might get with other animals, because often when they get arthritis, it affects both sides.
Yeah.
So it's another reason why, again, we don't see it. I mean, I read recently somewhere that only around 7% of cats with osteoarthritis are actually treated for it.
Yeah.
Which made me really sad.
No, really scary.
But I can see why. It's like, the perfect storm. The cat's hiding it, and we can't see those changes. So behaviour wise, it could be things like the cat it takes quite a long time to navigate up and down the stairs, or it just avoids the stairs completely.
Yeah.
Same for jumping up or jumping down. They might hesitate, before they jump up or jump down, or just find that quite a difficult thing to do. The cat might be less playful. Yeah. Or it could be that the cat is very much been an outdoorsy cat, and maybe it's a bit of a sort of hunter and likes to bring in, as they do, dead mice and things, and that's kind of stopped. So that's something we might see. Sometimes owners will report to me that cats are a bit, so the cat's grumpy.
Yes. Yeah,
doesn't like being handled. Now, there's lots of different reasons why that could occur. It could be pain somewhere else. It could be that the cat can't hear or see very well, and we sort of make them jump as well when we try and stroke them or pick them up. But it could be arthritic pain as well. So there's lots of different things that can sort of indicate that there's a problem with that cat's mobility. I think one of the most common things that we see in practice as well is that the cat starts house soiling.
Yes.
Now, there are lots of different reasons, as you know, why cats might do that. There could be another health issue, like kidney disease or hypothyroidism, or lots of gastrointestinal problems, lots of different reasons. But it could be as simple as the cat can't get in and out of its litter tray very easily. So, and obviously once that becomes a problem for the owner, and I can understand why, it's not very nice clearing up wee and poo. That could be an indication that there's problems with that cat's joints.
Definitely. And if going on to like home improvements and things like that, if you did have an owner come to you and say, oh, my cat starts soiling in the house, is there anything that I can do and they know they've got osteoarthritis, is there anything they can do to help with that?
Yeah, absolutely. So like you say, if they know the cat does have osteoarthritis, it's been diagnosed, and there's no other health conditions, so we can rule that out. There's changes that they can make to the litter trays, and also where they're placed and how many there are. So as cats get older, they tend to need to get to the tray more easily, more quickly. Again, they could have other health issues going on as well. So first and foremost, with the trays, it's quite a good idea to have one edge lowered. Now, I have looked, actually. I had a look today because I thought, I wonder if anyone's actually designed a litter tray that is low on the long side, not on the short side, on the long side. I couldn't find anything. I could only find some that were low on the shorter side.
Okay.
Which actually isn't that great, because the cat, especially in a multi-cat household, that cat needs to get in and out of that tray nice and easily. And cats are quite good at litter tray bullying and blocking each other from getting in and out of the tray. So I would advise using something like a potting tray or a planting tray, which are obviously not designed as a litter tray, but they can make quite good litter trays because they're completely flat on one side, on one long side. And that means that the cat can get in and out of its tray nice and easily. I'd also try and make sure that all of that cat's resources. So with cats generally, as you probably know, we recommend spreading resources out, having them in different areas of the house. Really important in multi-cat households. But as the cat gets older and it feels a little bit more vulnerable and is probably going to be a bit less mobile, sometimes it's an idea to still have enough of those resources, but have them, bring them in a little bit so it's easy for that cat to access them.
Yeah.
What you don't want is a litter tray upstairs for an elderly cat, and that's the only tray that it can
use.
To.
Yeah.
Need to have one on that level, but one or two, even two on a lower level as well. Yeah.
I think the important thing to remember, I use this quite a lot, is I'm like, imagine you've brought your 90-year-old gran back from hospital. She's just had a hip replacement. That is what your pet is now. You have to think of things that you do to adapt your house and what they normally use to help them.
I agree.
It makes a massive difference. It makes a massive difference. And also, I think you need to remember, if you get a diagnosis and you're put on medication and you're spending £50 a month on medication, and you've put them on a special diet and you take them for acupuncture and things like that, you're spending all this money, but they've still got to run upstairs and then try and jump into a litter. You're undoing all that good work with something that's actually free.
Absolutely. And I'm a big believer with environmental modifications. So basically changing your house to make it friendly for your elderly cat or whatever your cat's needs are, in making it really achievable and easy to do. Yes, you could make and I do know people that have done this, and it's great, a lovely ramp for your cat to go up to access its bed on the bed or the sofa. And that's fantastic. There's lots of information out there online for people that want to do that. But it might be that you just use another piece of furniture or some steps or something that you've got to hand for that cat to be able to do that. It doesn't have to be, expensive or time consuming.
Yeah, definitely. Is there any other home adaptations you would recommend?
Yeah, there's a few different things you can do. So I've obviously mentioned about number of resources and perhaps bringing them into where that cat spends the most time. You can try raising food bowls and water bowls as well. You can get some, I was only looking at some of these last week actually at BSAVA. In one of the nurses' practical stations, they'd set up a room to make it sort of old cat friendly, if you like.
Amazing.
And they had some really lovely raised food bowls. And I just really liked the way they were done, because the bowls were quite big and wide, which cats kind of generally prefer wider bowls to give room for their whiskers and things. So you can absolutely invest in one of those. Or you can do what I used to do, which was to put because I used to have a cat with quite significant arthritis in her elbow. And I used to put her food bowl on a book.
Yeah.
It worked just well.
Perfect. That's the trick.
Yeah, just little tricks like that, raising the water bowl. I think water fountains can work really well for older cats.
Okay.
A lot of cats, I mean, it does depend on the cat. They do have preferences, but a lot of cats like running water. And lots of the water fountains that you get are sort of, for the cat, and try to explain it, but for the cat to access the water, they have to be, it's usually at their sort of chin level anyway, or they don't have to stoop down too low. It's quite a nice way of encouraging water intake in older cats, which is really important anyway. So that's something else you can try. And then the other things I think people need to just think about a little bit are the sort of surface that the cat's walking on. So something that I've discussed with someone recently was using something like a yoga mat, like under the litter tray, so that the cat can also, when it's going to the litter tray, it's not slipping or getting its foot stuck in a carpet with lots of loops in it. And sometimes people do put mats down and runners down for cats to walk along. I think it just needs to be smooth and short, but not slippery, if that makes sense.
It's when they get their claws stuck, because their claws get a lot thicker, don't they?
Yeah, they do.
And it's when you see them get caught and they go like this, and you're like, oh.
And I don't know if this is true actually, so I'm hoping I'm not just making this up. But I was told, I think during my nurse trainings, this is a long time ago, that the little ligament that holds cats' claws in is doesn't work as well as they get older as well. So it's not just that the claws are in long, it's that ligament too.
No, I've had that as well.
Oh, good.
Maybe we've had it from the same false source, but I've heard that as well. But no, it's definitely, and there's just, well, they show pain differently to dogs, but you basically do the same adaptations as you would for your dog, and their nails are a massive thing.
The nails are a massive thing, and something I will advise cat caregivers to do with older cats. If the cat doesn't want to reach up to scratch, it's quite a good idea to offer them a horizontal scratching surface, and for that to be something quite soft. Now, obviously, cats do have their preference. Some cats will only use like the sisal or sisal rope, or they'll only use carpet, and carpet's quite nice and soft anyway. You can make something out of carpet. But actually, the cardboard cat scratchers, I find, for older cats can work really well.
Okay.
Because it's a bit less resistance when they scratch.
Yeah. No, that's a good idea.
Yeah.
So monitoring tools that you would, obviously you've got the checklist. Is there anything that you would also advise to owners to have if they've got an arthritic cat that they want to know that they're not in pain, the medication's working that the vet's prescribed, or the home adaptations they put in place, it's helping? What would you?
There's a couple more resources that I will mention. The first resource I will mention is absolutely use your veterinary team. Don't be worried about going. No one's going to laugh at you for going to the vets if you think your cat's having mobility problems and it turns out it's okay. That's not going to be an issue at all. We'd much rather you brought your cat in and we checked it over and made sure that any pain was managed properly. So use your veterinary team, talk to the veterinary nurse. I find for some cat caregivers, speaking to the vet can be a little bit intimidating and they can feel a bit overwhelmed with all of the information. So absolutely talk to your veterinary nurse in the practice team about how your cat's getting on, because they can go and talk to the vet at a later date and follow that up with any sort of additional consultations or phone calls, that kind of thing. Another really good resource that I've only recently been made aware of, but I think is good, is the Zoetis osteoarthritis checklist. That's really good. Got some fab infographics on it, and that was put together based on a study that showed that there were 6 key indicators of osteoarthritis in cats, and they're listed on the checklist. Now, as I mentioned before, there are a lot of different indicators that cats might have osteoarthritis, but I think with these ones, it was that they were only associated with arthritis. Whereas there's other things, like house soiling or cognitive dysfunction that could flag up other sort of issues. So I definitely recommend to both veterinary professionals and cat caregivers to look at that. Because it has some really good explanations with the infographics, and there's a little bit about behavioural changes as well. So that was the other one, and then there's another website. Let's make sure I've got it. Pain Free Cats. That's got the feline. I have to make sure I can say this properly because I always struggle with my words. Feline musculoskeletal pain index.
Cool.
Right. Which is a bit of a mouthful, but it's a validated tool and it's an online questionnaire. And owners can do that at home, or they can do it with their veterinary team in the practice. There's plenty of information out there, And as I said before, the International Cat Care website, if you just Googled cat care arthritis, you'd go to the page with information. So it's a
great website, and it doesn't put things in big medical terms and scary words. It's really easy to understand and navigate your way around. It's a great website and a great resource to have.
Really good.
We're going to add all of these. Nikki, to answer your question, are you able to send the link for the checklist? What we're going to do is, after the live, we're going to send you a whole load of websites to go to, and Alex is going to supply me with all the links, so you will have it all at your fingertips. We've had a question from Bonnie saying, my older cat, 17-year-old, scratches more and harder than he used to. Is that common for an aging cat with arthritis?
Oh, that's a really, really good question, because I would always think it would go the other way if it was a pain issue. Having said that, sometimes cats will scratch. I mean, cats, don't get me wrong, cats like scratching. They enjoy it. It obviously maintains their claws. It feels good. It stretches their muscles. So they like doing it. But sometimes cats will scratch excessively if they're feeling a bit vulnerable in their environment.
Yeah.
So if that's happening and that caregiver's noticing that that's happening more, and perhaps it's happening in undesirable places or places where the cat wasn't scratching before, and that change in behavior could be an indication maybe that there's some stress there. So I would, if they're worried, I'd contact their vet just to make sure there's no health issues going on there. But wouldn't have expected to see it more with arthritis, but
no,
there's always exceptions to the rule.
Yeah, exactly. They're all different. I hope that answers your question, Bonnie. We've also got one from John. We are both veterinary nurses, so we cannot comment on medication. But I think, as looking for a better solution, I think also adding in home adaptations, as we've been talking about, and just making sure that their claws are nice and comfortable and things like that. I think that's a big thing.
And I would say go back and speak to your vet, because as you know, often with arthritis, it's managed sort of in a multimodal way. So it won't be necessarily there's just one thing that helps that cat. It could be that the cat is having a medication, but it might need another medication on top of that. Or it could be that the cat needs some other sort of therapy, like, acupuncture or something like that helps it. And I know with cats, a lot of the sort of complementary therapies, there's not much evidence out there, unfortunately. It tends to be humans, dogs, and then cats last.
Yes.
But I am a big believer in, if it works and it helps, then give it a go. But it's something that you need to discuss with your vet. I wouldn't just leave it. I would go back and say, okay, well, that's helped for a bit. Can I talk to you about something else? Yeah.
And definitely, I think if you are thinking, is there more of a solution, or I don't know if the medication's working, using the checklist that Alex has been talking about is a really good idea. It also help your vet massively, and help to make your 15-minute consult more beneficial, because you're going with a plan with what to talk about. Also, videos are really helpful, because obviously the cat acts weird in they're not
completely normal, don't they? I'm fine.
Yeah, they just freeze on the table, or they're trying to run away. So videos of your cat just doing normal things in the house, like walking around, jumping up onto the chair, walking up the stairs, things like that. Don't make it obvious, like I'm videoing you, smile.
Yes, my cats have a habit of always stopping what they're doing whenever I try and film them. That's a real cat thing, isn't it? They always seem to do that.
Exactly.
I did just want to flag, I hope it's okay, just based on that that last question. Obviously, as we said, we're veterinary nurses, we absolutely don't diagnose and we don't prescribe. But I know sometimes there's a little bit of concern or fear with some cat caregivers about giving actual medications to manage pain. And I think it's important to flag that although sometimes the complementary therapies absolutely can help, most of the time medication is needed to manage that pain properly. And don't be scared of that. Talk to your vet about it. They're not going to prescribe something that they are worried is going to harm your cat. So I just wanted to highlight that, because I think it's important to manage the pain properly.
Definitely. And I think as well, if you are worried, ask for like a blood sample, take a urine sample in with you, and check that everything else is in good working order before, if you are really worried about giving the medication.
Yeah, and a lot of vets will offer that anyway, won't they? They'll want to check that everything's okay internally with the cat prior to prescribing the medication. So yeah,
definitely. Cool. Weight management in cats.
Yes,
I thought that was also a good point to add. I feel like you see it in a lot of dogs, but it kind of gets forgotten in cats, unfortunately. Same with lots of
It
different.
does. I mean, I think the internet's got a lot to blame for that personally,
Yeah.
because we think you get lots of these funny fat cat videos.
Yes. Yeah.
And actually what a lot of people don't realize is that cat's quality of life is quite poor because it's so overweight.
Yeah.
Now I got a question on my Facebook page for this evening, which I thought would tie in quite nicely with this bit. Someone asked me, they said, I've got a large breed cat. I believe it was a Maine Coon.
Yeah.
Is there anything specific I need to look out for with regards to osteoarthritis? And actually, I think this person was aware about this breed being predisposed to getting OA anyway.
Yeah.
Which they are. I think they get it in their hips, like Siamese cats do, and some breeds are more prone to osteoarthritis.
Yeah.
But I don't think there would be much that I'd manage differently, or that a vet would manage differently with that particular breed, other than it's even more important to monitor and manage that cat's weight.
Yeah.
Because they are a large breed.
Yeah.
So because they're a bit heavier, well, quite a lot heavier, aren't they? Like twice the size.
Yeah.
Beautiful cats, absolutely beautiful cats. But quite a lot bigger than your average cat. So twice the weight, it's going to push more on those joints.
Yeah.
And if that cat's arthritic, it's going to exacerbate that problem even more, like it would do in your average kind of domestic short hair, domestic long hair. But I thought I'd mention that. Yeah,
no, definitely. I think it's important, like as important with any patient with arthritis, human, cat, dog, horse, anything. Weight is a massive thing, and I think people think the swinging belly of the cat is quite normal.
Yeah, well, it can be. The primordial pouch is normal, but not an excessive size primordial pouch. And actually, I think you touched on it earlier, or explained it well earlier, in that we just sometimes forget that it is an issue for cats.
Yeah.
Them being overweight. That again, that kind of cute, cuddly, oh, look at that cat, isn't he funny where he's so overweight? But actually, if they're arthritic, and there was a study, I think it's a fairly recent study, that showed that cats as young as 6 can experience osteoarthritis. And I thought that was interesting, because that's that sort of age, that prime to mature age, is where cats start to get overweight.
Yeah.
So if we've got an sort of middle-aged overweight cat, it could still be quite significantly affected by the signs of or symptoms of osteoarthritis.
Yeah.
Obviously, when they get into their senior and then super senior years, when they're sort of early teenage, then they start to lose weight.
Yeah.
And that's something else we've got to manage as well. But yeah, I thought that was quite interesting.
Yeah, no, definitely.
Yeah.
I think the statistics of it is scary. I think, I saw one, I think it was on the ISFM website, saying that 60 to 90% of cats actually have undiagnosed OA and are just living with it, coping with it.
Yeah. It's pretty much, about 90% of cats over the age of 12 will have osteoarthritis. That's pretty much all cats.
Yeah.
And then, other studies that have shown that actually it could be 60% of cats that are middle-aged, which will probably shock quite a lot of people to know that. And I guess this is where the veterinary nurses come into play again, isn't it? When it comes to weight management. And again, I'd like to emphasize that please don't be worried that you'll be judged. If your cat's overweight and you really want to help it to lose that weight and to stay healthy, because we know that obviously if the cat's overweight, it's going to be more likely to be affected by other health issues.
Yeah.
Diabetes is another one, isn't it, with our overweight cats?
Yeah.
But this is where veterinary nurses come in, because we'll be there to help manage that cat's weight and give the right advice and do it in a proper, slow and staged way, so the cat loses weight gradually. No,
we won't ever judge. I mean, I've definitely had a fat cat in my life, so I
have as well.
At all, I would put my hands up and say I was that person.
I have, and I think that just shows that it's different. Cats are more difficult, to manage weight loss than dogs are.
Completely.
But it absolutely can be done.
I have a cat at the moment that I'm doing weight clinics for. It's 9.5 kilogram domestic shorthand, just quite a small boned cat. And the owner's doing everything, but the cat is now like, stuff you, I'm going next door, because next door's got tuna. And then she put a collar on him. He's actually walking up and down the whole street. So she's had to put flyers through the doors to say, please stop feeding my cat. Like, he's
so hard. This is why it gets difficult with cats. And cats very quickly learn behaviors that will encourage humans to feed them as well. And there's that whole misconception, isn't there? Oh, my cat's meowing, it's hungry. No, your cat is learned that if it vocalizes that you feed it. Literally. Not necessarily hungry.
No, exactly.
But yes, I can totally see why it's challenging for owners, and why it's difficult. But, you know, as I said, that's where veterinary nurses come into play. We're there to help support people. Yeah,
definitely. So we've got a question here from Amanda saying, should owners of cats aged 6 and over start to give supplements at that age? I also learned that recently and feel terrible that I didn't do something to help my cat earlier on. He's now 17 and now on Silencia and U-Move Advance.
Yes, that's a good question, isn't it, about sort of prophylactic joint supplements. I'm going to be really honest and say I don't know.
Yeah.
I know the evidence is quite limited with cats, although there was a study to do with fish oils, so your sort of essential fatty acids, omega-3s, and cats with osteoarthritis that showed that there was some improvement, but it was, I think it was like an owner questionnaire type study, so not sure how reliable that was. I think I would keep, to me, it would be the weight and monitoring changes in behaviour that I think would be more important. Because again, going back to the sort of nutraceutical side of things, these things may help, but it's the pain that we want to manage, really.
Yeah, definitely.
Yeah,
definitely. And I think also in your comment, Amanda, saying you feel really bad for not noticing sooner, that is what these lives are all about, is to try
don't
and
feel bad.
Don't feel bad.
No.
There's, I mean, 90% of cats in the UK are living with arthritis. It's scary. There's so many other people that aren't aware.
Yeah, and they are absolute masters in disguise when it comes to hiding any sort of vulnerability, because they don't want to, they don't want their predators to see that they're weak. So they're very good at hiding all these problems, all these signs.
Yeah, definitely. Another one from Nikki. You mentioned that the ligament doesn't work as well, that retracts the claw. Should I get his claws clipped? He absolutely hates it and it makes it so difficult.
I would advise making an appointment with your veterinary nurse at your practice. If I wouldn't stress your cat out by trying to cut its claws. If they're not getting caught in things and they're not obviously not curling round, which can happen, as you know, when they get really bad. And if you're seeing your cat scratch, cat's claws shouldn't need trimming, but sometimes when they're older they do. But if it's something you're struggling with, speak to your veterinary team and see if you can get your veterinary nurse to do it for you, because we're experts at doing that. And if they struggle, then they might talk to you about potentially giving your cat a little bit of medication at home before it comes in. But I can't really obviously comment on a specific cat or medication as such. But I think sometimes care plans that are offered in practice are great for preventative healthcare, but they have got a bit to answer for, because sometimes animals come in for things that they might not necessarily need. And claws is one of them. So older cats, absolutely. Sometimes I see cats come in that the owner's requested a claw trim, and it turns out it's because they've been using their hands to play with the cat and the cat's scratching them. Then we have to have a completely different conversation. I think I wouldn't suggest that someone stresses themselves or their cat out at home trying to trim claws.
No, definitely.
Let your vet nurse do it for you.
Yeah. Make us be the baddies.
Yeah, absolutely.
What top tips, if you had to say, right, I've got 5 top tips for an owner with a cat that's been diagnosed with osteoarthritis, what would it be?
Oh, I think I've covered a lot of them already.
Yeah.
I would say probably first and foremost, keep an eye on your cat's progress and then communicate that with your veterinary team.
Yeah.
That's the number one thing to do. So use those questionnaires that we've talked about. Speak to you can make sort of interim appointments with the veterinary nurse they can assess your cat. They can look at your cat's what we call muscle condition score to see if there's been any changes there, weigh your cat, and also, although we can't diagnose, we can absolutely see if a cat's having problems with its mobility as well, and then obviously report that back to the vet. Definitely, when it comes to the environment, just think about easy wins that's going to improve your cat's quality of life. And do have a look. There's a good web page on the International Cat Care website, and I think it's called, I can't remember what it's called. It's something to do with aging cats, caring for your elderly cat or something like that.
Yeah.
Some really good tips in there.
Yeah.
And just, don't be scared to seek treatment for your cat if you think that there's a problem, because often it is the behaviour. So it's the behaviour that you need to look out for, the changes in that cat's behaviour, not just the mobility.
No.
That's the key.
Yeah, definitely.
Yeah.
Definitely. I mean, they are complex little creatures, aren't they?
Oh, they absolutely are.
Bless them. So if anyone else has got any questions, please put them in now whilst we've got the lovely Alex with us.
Oh, there's one thing. I knew there was one thing I needed to mention. It's on my little list here.
Yeah.
Actually. And I've highlighted it because I knew I'd forget as well. And I did. I wanted to talk about cat flaps and cats going outside.
Yes. Yeah.
Yes. So I don't know about other people's cat flaps, but my cat's got quite a fancy cat flap that I've got a little app on my phone that tells me when they go in and out and all sorts. So I could keep an eye on them. But they have to, it's quite easy for them to go through it. But when they go through it, one side goes down quite significantly. Now, that is something I'm going to monitor as they get older. So my oldest, I've got 2 Siamese cats, and my oldest cat, Mr. Monkey Business.
Brilliant name.
He's 8 this year. So I'm going to be keeping an eye on his mobility, because they can get arthritis like any cat, but they're prone to arthritis anyway. But we know that sometimes arthritic cats can have problems going down. So it might be that an older cat needs a little bit of help when it goes. It depends on how the cat flap's situated, but usually it's when it comes out the cat flap and goes down. You might need to put some sort of platform there. It could be something as simple as a breeze block, or just something to lift up the ground a little bit. And then for some older cats, they struggle just to use the cat flap when they get older.
Yeah.
And it might be that as a cat gets into its sort of, especially the super senior years, so sort of 15 years plus, that actually caregivers have to let the cat in and out themselves, which can be a bit of a pain. But don't forget, a lot of older cats do get cognitive dysfunction as well. So sometimes they can get a little bit disorientated, and they won't spend as much time outside anyway.
No.
Yeah, so I thought I'd mention about cat flaps.
No, that's a really good point, actually. I didn't even think of that, but that's, really good point. We've had a point from Bonnie again saying playtime is so beneficial to cats. Is there a best way to play with your cat so that it might delay arthritis?
That's a good question. I don't think you can delay it as such, but I think playing is beneficial to keep the muscles strong anyway. So that's a good thing. Obviously, that's going to help support the joints. So it may help with management of arthritis. But play is also really important for cognitive function in cats. Yeah. And we know that regularly playing with the cat can help with prevent cognitive decline as well. Yeah. What I think is important is to play appropriately for the cat as a cat, which I'll explain properly in a sec, and also for the cat's age and ability, if you like. So something which got flagged to me a few years ago by Linda Ryan, the behaviourist, which I'd never even thought of, and when she said it I thought, oh, the penny dropped, was when you play with cats you need to mimic what their prey would be doing.
Yeah.
So there's no point in waving something around. I mean, you can wave things around in the air like a bird, absolutely, with some cats, but there's no point in sort of doing all this kind of thing with a toy, because for most cats, they just go.
It's like, what?
But that's not what their prey would do. You need to pull. If you've got like a fishing rod toy, pull it slowly, stop, pull it slowly, you know, mimic the prey, and they're much more likely to engage in predatory play if you do that. So I thought, oh yeah, and the prey wouldn't naturally go past the cat either.
No.
So you need to go away from the, the cat.
Yeah.
So that was a real eureka moment for me. I was like, wow, I hadn't even thought of that before. It makes perfect sense. So mimic what the prey would do. You can, as I said, you can sometimes wave some of the toys around like a bird, sort of slowly. But then you need to think about the cat's mobility. So for some cats, they might prefer self-play with like a little sort of mouse toy, or depending on what their hips are like the kickaroo type toys.
Yes,
where they can rake, and they can be quite good at keeping the back legs strong as well.
Yeah.
What was the other thing I was going to say about using toys? Oh, and also with puzzle feeding as well.
Yeah.
Now I'm a big fan of puzzle feeding for cats. It helps with their brain because they're sort of naturally foraging like they would do. Obviously they hunt, but they scavenge as well.
Yeah.
They're opportunists. But puzzle feeding can be good to sort of give them a little bit of a workout as well.
Yeah.
And you can absolutely puzzle feed older cats.
Yeah.
It might be, if you're introducing it later in life, you need to start with a really simple puzzle feeder, not a really difficult one.
Yeah.
Probably won't use it.
Cat stopped eating.
Yeah. Well, this sometimes happens with all cats. So you need to start, depending on what type of puzzle feeder you have, start with on the simplest setting. Yeah. Or even like things that don't cost any money, like an egg box carton.
Yeah.
You can put the food in it and they can fish it out.
Yeah.
If the cat's not too keen on using its legs, because maybe it's a bit uncomfortable there, you could get something like a treat ball.
Yeah.
Have it on the most open setting so the cat can use its nose to knock out the treats, or the licky mats as well. They're really good.
They're brilliant. Yeah. We use them a lot in practice.
Yes.
And
do you have the ones that stick to the wall?
Yes, amazing.
They're brilliant, aren't they?
They're so cool.
Yeah. And I like the ones, my cats have got the flat mats, but I do like the ones that stick to the wall. And I imagine for a cat that's maybe a bit creaky in its neck, that's probably quite a nice way to access its food. And obviously they're good for wet food, aren't they?
Yeah. No, but they're brilliant. I also, for my cat, I feed her with a snuffle mat.
Yes.
Which was fab. Yeah. I literally just made out of a mat and tied loads of
you made your own snuffle mat?
I did make my own snuffle mat.
Impressed.
It was when it was really sunny in lockdown and I didn't have anything else to do.
I'm impressed. I bought mine, but you'll have to show me what you did to make one. That's great.
It's good. It was good. It was good fun, but it takes a very long time. But snuffle mats are good. Yeah,
snuffle mats are good, and it just keeps their brain busy, doesn't it? As well as keeping them moving, which I think is always a good thing for older cats.
Definitely. Also grooming them if you do have a cat with mats, obviously keeping them. Cats are very clean creatures and they get very upset if they're not clean. So brushing them, would you recommend brushing them and keeping them?
I would, but I would also be mindful if the mats are there, because sometimes if their teeth are bad, that can contribute to them getting mats as well. Often cats, as you know, will get both.
Yeah.
So they'll have dental disease, chronic dental problems, and they'll have osteoarthritis. But I would be mindful if the cat's not on any treatment for its arthritis, that it might be a little bit uncomfortable. So the best thing you can do is make an appointment with your veterinary nurse, and we will remove those mats for you with our nice cat-friendly clippers that are nice and quiet.
Yeah.
Because if the mats are very close to the skin, obviously it's sore, isn't it?
Yeah.
Once that's done and the arthritis has been diagnosed and is being managed, then absolutely you can start to groom your cat. And there's lots of nice soft, like you can get, I quite like the mitts.
Yeah, the mitts are good.
grooming mitts are quite good.
You can get the little purple like cat. Is it called a Zoom groom?
brooms.
Yeah, they're good. Nice and
they're
soft.
quite nice. Yeah, something that's soft and isn't going to be uncomfortable, because I suppose my worry would be if someone was grooming and that was uncomfortable for the cat. I don't want them to get scratched or bitten because the cat's like, oh, that hurts a little bit,
No, exactly. Cool. Is there anything else that you'd like to add this evening?
I don't think so. I think I'm just having a look here to see if there's anything else additional. Oh, there was one thing. I think it was in one of the questions that we had, and we were talking about discussing arthritis with perhaps other cat owners that are in the same boat as you.
Yeah.
And there's really not much out there for owners of cats with osteoarthritis. There really isn't. Which made me think that's because there's a lot of cats that are coping with it, or not even coping with it, are living with it but not being treated. I mean, I'd always advise speaking to your veterinary team first and foremost. But certainly it'd be good to share tips about maybe environmental modification and that sort of thing.
Definitely.
And I'm happy for people to do that on my social media pages if they want to share tips. I like learning new things. So
no, definitely. Some things that come up on Holly's Army, it's amazing what people do, like just modifying in the house and stuff like that. It's like, wow, the ideas people come up with is great. So definitely head over to Alex's pages, which we'll also add in the thread afterwards for you guys to have a look through. And like we said earlier, all the websites and resources, we're also going to just bombard you with links to go and have a look and explore and find out more. But thank you very much, Alex, for joining us this evening. It was great talking to you, and I've definitely learned a lot, and I hope everyone else has benefited from this evening. So yeah, thank you very much.
Thank you. It's been an absolute pleasure. And as I said, once I get going, there's no stopping me. I love talking about anything cat related. So it's been an honour to be here. Thank you.
Thank you very much. I hope everyone enjoyed it. Next week we will be, I can't remember exactly what we're doing next week, but we will be back on to dogs again. But I would love to get everyone's feedback on what the Cat Month has brought to them, and if they've enjoyed it and if they'd like it again. We do listen to you guys, and we want to make it a place that everyone enjoys. So thank you.
Brilliant. Thanks so much. Thank you.
No problem. Bye.
Bye.